Hi everyone. So today we will be talking about our drug presentation, which is alprazolam. My name is Anmol Kaur.
And my name is Caroline Kawili. So we're going to start off with some basic drug information. Our generic name is alprazolam, and our trade name is commonly seen as Xanax. Drug classification is benzodiazepines, and the therapeutic class is anxiolytics. And the general effect of this drug is that it will help with relieving anxiety and panic attacks. And it's important to note that alprazolam is a Schedule IV controlled substance, and that means that these are there's a lot of drugs that are listed based on abuse potential, and it's rated with Schedule I being highest abuse potential with no medical use, and Schedule V is minimal medical, minimal abuse potential and has medical use. So for alprazolam, it's a Schedule IV drug, meaning that there is some abuse potential, and we'll get into more of that later on. Right now, we'll go ahead and focus on mechanism of action and pharmacokinetics.
Okay, for part of the mechanism of action, so it acts at many levels in the CNS to produce the anxiolytic effects. It may produce CNS depression, and the effects may be mediated by GABA, which is an inhibitory neurotransmitter in our brain, and it may suppresses the seizure activity from spreading. And then moving on to the pharmacokinetics. So for the absorption, it is very well absorbed from the GI tract, almost like 95%, 90%, sorry. And for the onset, it's from 1 to 2 hours. For the peak, it can take 1 to 2 hours. And for duration, it can go up to 24 hours. And its half-life is between 12 to 15 hours. And for the distribution, it is widely distributed throughout the body, and it can cross blood-brain barrier and probably crosses the placenta and enters the breast milk in the women, and its accumulation in the body is minimal. And for the metabolism and the excretion part, it is metabolized by the liver and um, um, to an active compound that is subsequently rapidly metabolized. And then moving on to our next slide, we have our NCLEX question, first NCLEX question. So I'm going to read the question. Alprazolam can interact with which of the following transmitters to promote its therapeutic effect? So I'm going to let you go through the answers and think about it for some time. Well, if you guessed the answer D, that was correct. The gamma amino butyric acid, which is also known as GABA, or inhibitory neurotransmitter. So, in the alprazolam's mechanism of action, it works to promote the effectiveness of GABA, so which is putting a stop to an activity, so which leads to calm and inhibitory effects seen with the medication use. Then moving on to our next slide.
We're now going to focus on dosages and side effects. So common doses for anxiety is 0.25 to 0.5 milligrams, given PO 2 to 3 times daily. You'll have a total max of 4 milligrams per day. And the routes that are commonly given are orally, and you can receive this medication through oral solutions, tablets, or extended release tablets.
Okay, so for the side effects of this medication, it can cause effects on different parts of our body. So for the CNS, it can cause dizziness, drowsiness, lethargy, depression, headache, and a patient may also feel hangover. And for the EENT, it may cause blurred vision. And on GI tract, the patient can experience constipation, diarrhea, nausea, vomiting, and weight gain. And the other side effects the patient may experience, it could be physical dependence, psychological tolerance, rash, and difficulty breathing. And there are also some adverse effects associated with this medication. The patient may experience shortness of breath, decreased respiration, confusion, memory impairment, and difficulty speaking. And it's important to note that when medications such as alprazolam, when it's administered to the patient, the treatment is only given when the other treatment measures are deemed ineffective for the patient care. Now, moving on to our next slide.
We'll go over contraindications for Xanax along with food and drug interactions that it might have. So as you can see, there are a lot of contraindications and interactions. Some main ones to note are cross-sensitivity with other benzodiazepines, pre-existing CNS depression, because this drug will depress your overall system even more. If you have any kind of respiratory issues such as obstructive sleep apnea or pulmonary disease, this will also cause respiratory depression, which will lead to more trouble breathing and overall. If you also have history of drug and alcohol dependence or pregnancy and lactation, you are also contraindicated for this drug because during pregnancy, Xanax can actually transfer through the placenta and breast milk. And having that history of dependence is also risky because this drug, as mentioned, is a Schedule 4 controlled substance. Some drug-to-drug interactions, as we can see, there are a lot. Some main ones to note are opioids, general anesthetics, antipsychotics, alcohol, anticonvulsants, hormonal contraceptives, and another main one to note is cannabis use and cigarette smoking. A main anticonvulsant that we want to look out for is if a patient is taking carbamazepine, as this can actually reduce therapeutic effects and increase this alprazolam's metabolism, meaning that the metabolism and breakdown of alprazolam will be sped up and not last in the body for the ideal therapeutic duration that we would like. So because of that, the dosage for alprazolam may need to be increased. And the main drug-food interaction that we want to know is of grapefruit juice. So we really want to educate to our patients that to not take this type of juice because it can increase the levels of alprazolam unintentionally in the body. So it'll lead to the increase in excessive adverse effects that we mentioned previously. We'll now go into our next NCLEX question. And this one is focusing on contraindications. So it says anxiolytic drugs such as alprazolam would be contraindicated for which of the following patients? And this is select all that apply. So go ahead and choose which answers are contraindications. All right, so if you chose A, a first-time mom 7 months pregnant who is nervous about her first delivery, and C, a patient with a past medical history of alcohol dependence and abuse, you are correct. So contraindications, as mentioned, included alcohol dependence and pregnancy. Alprazolam can cross through that placenta and breast milk, which leads the fetus to being at risk for harm. Use with alcohol can also increase sedation and depressive effects of alprazolam. So you would also have those increased side effects. So an increased feeling of respiratory depression, maybe increased confusion and stuff and symptoms like that. We'll now go ahead and go into interventions and labs.
Okay, as for the nursing responsibilities, so the nurse would assess for the respiratory depression, sedation when the patient is taking this medication with the opioids, and if the patient does experience GI signs and symptoms when taking this drug, it can be given with the food to reduce those signs and symptoms. And the nurse should be aware to taper this medication by 0.5 mg every 3 days to prevent the withdrawal symptoms and to always start this medication with the smallest effective dose to prevent the ataxia and also assess for the CNS effects and the fall risk, and especially in the geriatric population, and to also monitor for the dependence, misuse, or abuse of this medication. And some of the patient education we can provide is to let them know to take this medication as prescribed and do not increase or decrease this medication. And to educate on the abuse risk, since one of the side effects of this medication is the building up the tolerance and dependency on this medication, and to also let them know to avoid driving and involving in the activities that require alertness because it does cause the CNS depression and to also avoid alcohol, smoking, and grapefruit juice since those were contraindicated with this medication, and tell them to do not stop this drug abruptly because they may experience severe withdrawal symptoms. And some of the lab values to consider while taking this medication is to monitor for the CBC values, monitor for the liver function because it may cause an increase in the ALS or the AST values, and also monitor for the renal function. And then after that, we're gonna move on to our last and quick questions. And I'm going to read off the question. A nurse is planning to educate a patient during discharge about alprazolam. Which statements identify further teaching is needed? And this is a select all apply, and I'll give you some time to go through the answer. And if you selected B and C, which is if I do not if I don't feel anxious anymore, I can stop my medication right away. And this medication is safe because there is no chance I'll become addicted to it. So these were the correct answers because definitely it is recommended to slowly titrate the dosage when stopping the alprazolam, as abrupt stop can cause withdrawal symptoms such as seizures. And the alprazolam is a scheduled for controlled substance drug, which is identifying that there is some potential for addiction and abuse. So it is vital that the patient understands this risk. Along with the dot. So these are our resources that we used for our presentation. And thank you everyone for watching our drug presentation.